Hi, everyone. Welcome to our podcast. Today, we're talking with SleepCycle about their new cough radar feature. It's a game changer for tracking coughs and respiratory health while you sleep. We'll dig into how it works, how it could help with early disease detection, and what's next for SleepCycle. So let's get started. Well, welcome, Mikael.
Thank you very much.
Welcome, Mikael. Great to have you here from Sweden. You've been at this mission for a while. So talk to us about the big idea behind SleepCycle and the changes you're hoping to bring about in sleep health and quality.
Sure. So what we want to do is really, it's sleep, but it's larger than sleep. We want to improve global health. That's what we want to do. Right. And we want to do that by providing tools and insights into our users' sleep so that they can improve their sleep. And from that, we know it's connected to health. So that's like the big goal, I think. So what do we do at SleepCycle? I mean, we're really expert at audio-based sleep tracking. That's where we shine. So we can do things like we can track the full respiratory system, your breathing rate and your breathing stability throughout the night. And we can use that to do things like sleep staging, but we also do, let's say, general event detection so that you can listen to, if you're snoring during the night, then we track your snoring and you can listen to your snoring. And also if you're talking in your sleep and you say something funny, then you can listen to that in the morning as well. So we do a lot with that. But yeah, you're right. What I want to talk about today and what you introduced, it's really something new. It's something where we leverage our position, I would say, to kind of have an impact on our mission and do something completely new. So what if I told you that we could give you something very similar to, let's say, weather report, right? Like a rain map, but for coughing, so that you can use that information and understand whether or not there's some coughing coming in where you work, maybe, so you can take an informed decision whether or not you should take public transportation going to work today, or maybe today you should, I don't know, work from home. And the same for planning our weekend, right? So that's really the goal that we want to achieve with Cough Radar.
Wow, amazing.
Very interesting.
Yeah, fascinating goal. And so tell us about the service. Cough Radar is a feature in your SleepCycle app. How does it work? And how does it, with users, how can they leverage it?
Absolutely. So I think some background might be in order. So what we do at SleepCycle, we're a sleep tracking app. We have about, active user base of more than 1 million, maybe 1.5 million a random night. So having that base in about 150 countries around the world means that we are analyzing 8 hours of audio for all of these people in this big, huge, you can think about it like a global sensor network. We're actually analyzing it's a big number, about 1 millennia of sleep audio every night. So that's the amount of data. We're doing it on the user's phone to make sure that it's private, but we can really detect anything. So we were thinking, all right, so we have this mission. We want to improve global health. Can we do something more? And this was like after the pandemic, or it was just towards the end of the pandemic. So we're kind of top of mind with coughing and so on. So we were thinking maybe, just maybe, could we create coughing maps and then do this every day so that we could see how these clouds of coughing move around the world, to see if we can see patterns. I mean, for me first, it was just a curiosity. With the research background, I was really like, oh, will we see anything or will be nothing? It turns out that there is a fair amount of structure. So we now have that. We compute those maps every day. We take anonymized statistics from the users and an approximate position. So we make sure it's not an exact position, and we noise it so it's different every night to make sure that we don't want to track individuals. But we can use this to create these maps and now have that early warning system. And that can be, if you're a premium user, you can use it inside of SleepCycle app.
Amazing.
Great. So obviously cough came into large focus, I think, to basically everyone during the pandemic, including how far it spreads, what is a safe distance to avoid picking up the germs. So just tell us, how accurate is Cough Radar in detecting coughs, and what methods you use to ensure that accuracy?
Yeah, so that's an excellent question. It turns out it's actually very, first when I thought about it, I thought, well, maybe it won't be very accurate. But it turns out that it is actually very, very accurate. So when you compare it to the other types of methods that can do something similar, the early warning systems, the only one that comes to mind is really Google Flu Trends, I think it's called, where you can get some kind of early warning system because people start Googling on flu symptoms when they start getting sick. Well, first of all, it's not as early because you have to actually realize that you're sick before you Google. And secondly, if there is a lot in the news about flu, then people start Googling about it. So it's quite noisy. So it's not that useful. What we do is that we actually measure the underlying biological phenomena, if you will, of coughing. So we actually count the coughs. And the accuracy on detecting coughs is very good. We have annotated a large corpus of audio, so hand annotated where the coughs are, and then we just train our algorithms to detect those and verify that we can do it correctly. So it turns out this is actually very, very accurate and extremely early. So usually you know that you don't know that you are sick when you start coughing in the night. So you can even see in your own app in the morning that, oh, I'm starting coughing here, and then but I don't feel sick. Then a couple of days and you realize, okay, so maybe I was. So yeah, it's very accurate, and we also validated it against COVID data. So this was again towards the end of the pandemic. So we had this nice data graph. So we used the United States as a case study, and then we looked at the COVID waves coming and going, and that was pretty much all that was going on right then because everyone was working from home, so it was most COVID. So we could see those waves, and then we correlated that against our trends that we have. So we have about 2 years of data now, and we could see that there was a very nice correlation, and we also saw that 2 weeks in advance, because what's going on when you have to first feel that you're sick, and then you go to the doctor, and then the doctor reported this, and that took about 2 weeks. So we saw that delay in their data compared to our data.
Interesting.
Fascinating. And so how is the data from your Cough Radar analyzed? How's it presented to users? And how do you make it easy to spot patterns and trends?
Yeah, so we present it as a map. So it's pixels on a map. A huge number of pixels, because we are available again in the whole world. So it's actually about 70 billion of those pixels on our maps. So you can zoom in wherever you want on the map, and then each of those pixels represent coughing in an area up to 7.5 kilometers. So if you're in that area, then you will be part of the data set that's kind of contributing to that pixel. And the pixel in itself is only shown, and this is important for privacy reasons, it's only shown if there's at least 125 people in that area. And we do that because then we will never be able to identify a certain person, and so I can even prove that it's possible with something called differential privacy. So now when we have these areas, so that's really what we model. We don't model the people per se, but we model the area. So you can think about that as a Poisson distribution. So it's a rate, really, a coughing rate. We compute the coughing rate over the whole world or a very large region and for the whole year. So we know how much you're supposed to be coughing, if you will. And then we compare the coughing rate in that particular area to how much you are supposed to. And then we say, well, if it's more than, let's say, if you cough more than 20% of the time, then we say it's elevated. And if it's a top 10%, then we say it's high. So that's really how we decide the color of the pixel. And that's how we compute for everywhere in the world. And trends is also a good question. So, I mean, the strength I think we have with this is that first of all, we get it in almost real time. I mean, in the morning, it is more or less real time, but then you don't really sleep or not as much during the day. So I guess it becomes less real time during the day, but it's very much fresh data. And we keep this. We have about 2 years of data ourselves. In the app, you can see up to 6 months back. And so you can scroll over time. So you can actually play this. You can, again, think about it as the rain radar that you get from your favorite weather station, where you can kind of see the clouds moving around. You can do the same here, but with the coughs. And you can also see the coughing levels as a graph, how it goes up and down. And that's interesting because then you can see some patterns that starting to emerge. You have some peak. Right now, we had a peak in Gothenburg. I could see where in Gothenburg it kind of emerged, and we saw it spreading in the city. And you can see seasonal patterns like, of course, you cough more during the winter. You cough a lot more during Christmas, but that probably because we meet our friends and family. And you can even, that hypothesis is something you can test by looking in Australia, where you have the opposite seasonal pattern, but you still have a lot of coughing going around when it comes to Christmas. So that's how it works.
Well, that's really great. So far as I understand it, this cough radar I can use both to identify my own early symptoms, potentially 2 weeks prior to actually like consciously realizing that maybe I'm sick, so I can prevent spread to others. And it also looks from looking at all the other data you collect, I can also see where a lot of cough is happening and maybe avoid going to those areas. So it's kind of like dual purpose. Is that correct?
Well, I think maybe you don't start coughing 2 weeks in advance. That's more like the reporting time and so on. But it could definitely be a couple of days. I'm not I'm the wrong kind of doctor to know that. I'm a computer scientist. But yeah, a few days at least. Or
okay. Well, that's good. That's a head start.
Yeah, and the other part, yes, absolutely correct. I mean, that's an amazing thing you can do. I mean, decide whether or not you want to work from home today. I think that's one good use case. You can decide if you want to take the bus or take the car, I guess, or take the bike. So yeah, you can do a lot with that data. Definitely.
That's
for
great.
Yourself.
And then so follow up to that because it contains so much personal data. You already talked a little bit about privacy, how it's kept just on my device, but talk a little bit more about all of the data. How is it kept secure and private? You talked about doing the anyway. So tell us more.
Absolutely. So first of all, and I think this is super crucial, we do all of the audio analysis on the phone. There's so many reasons for that. First of all, it would be prohibitively expensive for us to do it centrally because we're talking about 4.5 petabytes of audio that we would need to analyze each day. So that's not something that we want to do, but also for privacy reasons, we don't want to shift that data from the phone. So all the analysis is done on your phone, never leaves the phone. That's step one. And the second one, we don't track individuals. So when you when the data is sent to us, there's no identifier. So not even from day to day, we would know that it's the same individual. There's no identifier. And the position, so it's a bit technical, but we added something called Laplacian noise to the coordinates, to the position, so that it kind of jumps around in a pattern that's not possible to predict. And therefore, we will never know if it's the same individual that starts or stops coughing. And that's not what it's about. It's about the area. So we can always look at an area. Could be like on the map, it's a disk, but it could actually be any polygon. So we have had, with some partners, we have looked at the states or looking at different regions like within a city and so on. And we can do that as well. But so for privacy, that's what we do. First of all, audio never leaves. Secondly, we only model you as a group of 125, at least 125 individuals, and therefore it's mathematically provably impossible to identify you in hindsight.
Well done. Let's talk big picture. I mean, how and can the data be gathered in a way that contributes to broader, health goals? And what is the big picture beyond cough radar that you're striving towards?
Yes, I definitely think so. I think the biggest like low-hanging fruit, if you will, and then I have some indications after talking to people in that area, is to create early warning systems for public health authorities, because this is high resolution data. It's a very early warning. It's high accuracy, and we have a really good coverage over many of the important markets. So looking at looking at the UK, for instance, we saw that we cover about 80% of all people in England. So that's pretty good. And the reason that we do that is, of course, if you live on the countryside by yourself, then you're not going to be covered. But very few people do that. Most people actually live within cities or live in somewhat denser areas, and therefore we do cover it. So I think that's one thing, both to inform public, because that's something that these authorities need to do to keep the public informed, but also to optimize logistics around. Let's say you want to move nurses or doctors around to the right clinics to make sure that if there's a lot of influenza or something happening there, then you can kind of optimize those systems. So I think both of those cases could be really interesting. The second one I would say is just for us going forward is looking at deeper analysis. So as it is right now in Cough Radar, we wanted to do something that was simple and accurate. So we just say coughing. So we don't really differentiate within Cough Radar different types of coughing, but we could definitely do that and see if we could maybe look a little bit deeper into what caused the coughing to get an even more high resolution image than we have today.
Fantastic.
Well, let's stay with global health, but expand even further beyond maybe cough to general sleep and respiratory health. Are you participating in any studies or research or anything else happening within those wider areas of just sleep quality and respiratory health?
Yeah, so we always try to help out as much as we can. So we've been part of a number of different studies throughout the years. I can't really go into the details about the things that we are doing right now, because we want to do press releases around those. But one thing that we did not too long ago was together with Harvard Medical, Rebecca et al. So in that case, we looked at how sleep were affected by the COVID pandemic. And we see that they were people actually slept longer when the restrictions were in place. So that's one thing. And then around the respiratory, I have some ongoing dialogues now that I think is really interesting, both one here in Gothenburg and one with a team at Cambridge University. And that's more around Cough Radar. And I hope to be able to say more about that later, but I can't really speak about it right now more than
Great. We'll have to have you back to talk about that. And how do you must have a very exciting roadmap and vision for this platform. How do you envision Cough Radar evolving in the future? You know, could it be a tool for early disease detection in general?
So possibly, definitely. So I think it's going to depend a lot about how laws and regulations are set up, how easy it will be to do that. But as it is right now, as long as you're not detecting disease in an individual, but actually looking at disease on a broader perspective, so for the public, it's possible to do. So that's definitely something that we could do, and technically we could do it, and we have the position with being able to analyze this much audio to actually do it as well. So absolutely, it's something that's possible, but I can't really say more about it than that.
Fantastic.
Well, maybe you can't say much about my next question about what's next for SleepCycle in general. Any thoughts about expanding into like health monitoring features beyond coughing, like heart rate variability or breathing patterns, or even sleep apnea? Anything you can share with us?
Well, we try to be. I think we try to keep this in two areas. So one of them is really being close to what we have now and being close to the user, listening to them, talking to the users, and see how we can kind of evolve within the niche where we are in. And the second one is really what we did here with Cough Radar. Just sit down, understand what kind of adjacent areas do we have, things like wellness, fitness, weight loss, things like this, that kind of somewhat close to where we are now, and where we have a leverage with the position that we have with the size of our population, our user base, and the technology that we have as well. That's what I can say. So that's definitely something that we are looking at all the time, and that me as a CTO, I think maybe it's the most exciting part, because I love being on the edge on what's possible and see what we can find there.
Yeah, very exciting. Any personal travel plans or events coming up that you're excited about? Talking to consumers or businesses. I know we have CES. That's a big event for digital health coming up in January. But what else is on your mind?
Well, there's a lot of traveling now. So I actually went to CES this year, but I don't think I will be going back the next year. We'll see. But we have a few conferences planned. We are going to one in London and a few in Germany. Don't remember the names now. It's let's see. It's called. Is it Giant Health? I think in London.
Oh yeah.
Yeah.
Yes.
Fantastic. Well, you're doing such amazing work. It's really so thrilling to see the opportunity here as we all are thinking more about health and wellness and leveraging technology to be well. So thanks, Mikael, for joining. Really appreciate your work and can't wait to try the app myself. I think Irma and I are both going to give it a try, and we'll get back to you with user feedback. Thanks so much, Mikael, for joining.
Awesome.
And thank you everyone for listening and watching. Bye.
Take care.